The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. I'd like to ask the Premier about long-term care. In the midst of this greatest greying tsunami in our history, with 1,300 and counting people on the waiting list to find a place in long-term care in our province, the total number of new beds which have been opened in the almost 8 years that this government has been in power. I say opened, I mean not planned, not on the drawing board, but opened. The total number is 57. What is the Premier's opinion of this record?
The Honourable Premier.
Thank you, Mr. Speaker. And long-term care will be a priority of this government moving forward. It's a priority for our province and governments across the country who have been affected by the pandemic, and the conditions in our long-term facilities need to be improved. We need to start building more and more beds, especially in growth areas, Mr. Speaker. There was an announcement back in previous to my time in this role, Mr. Speaker, where we're going to rebuild 7 sites, Mr. Speaker, 236 more beds in the HRM area, Mr. Speaker. There's plans that are fully underway in the Cape Breton area, Mr. Speaker, New Waterford, Mr. Speaker, Eskazoni, and so on down the line. So we do have a capital plan. It's an aggressive one, as we do throughout the healthcare system. We're going to continue to make those strategic investments, especially because of the impacts of COVID-19. Thank you, Mr. Speaker.
The Honourable Leader of the New Democratic Party.
Thank you. Mr. Speaker, the Department of Health has been very clear for some time that moving from the older model of nursing home construction, which was built around shared multiple occupancy, to the newer construction standard built on one resident, one room, one washroom, is vitally important from the point of view of controlling the spread of infections. And yet today in our province we have right around 3,000 people living in shared accommodation designed facilities in long-term care facilities in Nova Scotia. Now at the rate at which this government has moved over 8 years, 57 new beds having been opened, it would take us to address the needs of those 3,000 people multiple generations. Mr. Speaker, is the Premier without embarrassment about this record?
The Honourable Premier.
Thank you, Mr. Speaker, and I'm proud of the investments that this government has done in infrastructure across the province, Mr. Speaker. Not only did we inherit a financial deficit that was on record levels in 2013, but we inherited an unprecedented infrastructure deficit, Mr. Speaker. Successive governments did not invest not only in acute care, Mr. Speaker, at the VG and some of the aged buildings, but in long-term care, Mr. Speaker. And that's why we continue to look at ways that we can manage the budget prudently so that we have room for these types of investments that were recently announced, and we're going to continue to look at other areas that we can prioritize investments in long-term care, and acute care, and the whole spectrum of continuing care. Thank you, Mr. Speaker.
The Honourable Leader of the New Democratic Party on his final supplementary.
Speaker, when we note that there are the 1,300 plus people on that waiting list for long-term care, we're not talking exclusively about people waiting in their homes. We're also talking about the hundreds and hundreds of people who are being housed in hospitals. In the last 5 years, Mr. Speaker, the amount that this government has spent on housing people in, as it's called, alternate level of care, housing people in hospitals, is $60 million. That would provide financially for opening around 500 new nursing home beds, which is about 10 times the number that had been opened by this government over the course of its 8 years. So can the Premier tell us what has been the logic? What has been the thinking and the rationale that has led the government to put so many people and leave so many people in this position?
The Honourable Premier.
Thank you, Mr. Speaker, and I'm glad to be able to start off in this administration with such a strong financial footing, Mr. Speaker. One of 3 provinces, according to the Canadian Parliamentary Budget Officer, that said we were on a sustainable fiscal path, Mr. Speaker. That allows us to increase our investments across the board in continuing care. We're going to see historic investments in this budget, Mr. Speaker, on infrastructure, Mr. Speaker, on staffing. We're going to continue to look at areas, targeted investment that Nova Scotians need and deserve. Thank you, Mr. Speaker.